here to talk about inclusive, sustainable economic growth, and when we talk about it through the lens of the continent of Africa. Let's just start here, because we were talking a little bit, and I think the through line between both of your companies is this idea of digitization potentially helping with this growth potential. Teresa, can you just talk about why you think that is the lens that we should be starting at when we think about the African continent and the growth that we could see?
Yeah, absolutely. So first of all, thank you for hosting us. So, one of the things that we've really realized is that companies and organizations that are digitized are more resilient and can innovate more quickly. And so we know that that's better for innovation in any place, including Africa. So, that's, I think, kind of foundational to Microsoft's outlook in the world.
Eyong, do you see, is that the same perspective from GE?
Yeah, absolutely. So if you look across sub-Saharan Africa, and anyone that's traveled to a public facility or hospital facility on the continent, you'll know when you open up these rooms and you've got stacks of boxes of folders of people's medical data. In there is so much information that's required to be able to deliver better outcomes. So being able to take that information, digitize it, and then utilize systems, equipment, and other technology to scan, get imaging information, and then connect it with that data that was there from a medical records perspective is absolutely fundamental to be able to deliver the type of healthcare that's needed in the continent. So we all know about the issues around number of doctors, number of nurses being particularly low across the continent. So it's only going to be digitalization of the healthcare infrastructure that's going to enable you to deliver healthcare for the continent. So it's absolutely fundamental and critical.
Well, and we saw, Eyong, I think during COVID, we saw a lot of governments really step up and implement a lot of digital solutions. But what's been interesting for me to look at is that we're not seeing this really translate to better health outcomes. So what is the gap that still exists right here from your perspective in healthcare?
Yeah, I think it's probably a bit too early to see it, right? But if I take intensive care beds, before COVID, we had some countries on the continent that didn't have a single intensive care bed, right? COVID has impacted on that, and now you see across pretty much all of sub-Saharan Africa, everybody's got some degree of provision now of intensive care beds. So that will then lead to health outcomes as we go forward. If you look at the rollout of telemedicine or telepharmacology or radiology, again, access has increased, and that will pull through into better outcomes over time. But outcomes is a bit of a lag indicator, right? The early insights are people being scanned? Are the number of scans and the amount of diagnosis that's on the continent increasing? Yes, that is. Are we starting to chip away at early detection of some of these problems? Yes, we are. Is it anywhere near the scale that we need? No, but it's absolutely moving in the right direction. And I think as time moves on and the governments continue to spend the amount that they're spending in healthcare and increasing the amount they're spending in healthcare, you will start seeing better outcomes over time.
Well, yeah, one thing that occurs to me, I mean, part of the issue is the infrastructure, right? If only 40% of Africa is online, that is going to be a part of the problem. And so, from Microsoft's perspective, it's very important to get more of Africa online. And, we've announced today that we're extending our Airband initiative to cover 100 million people in Africa by the end of 2025, including through a partnership with Viasat. So it's so foundational to all of this conversation that just, can people access the internet? That's the only way you can digitize health records to improve outcomes. And we think that actually the infrastructure is the thing that then leads to changed outcomes, kind of across healthcare, across education, across economic opportunity.
Where is Microsoft seeing it work? Because you mentioned $9 billion has been poured into this connectivity. I mean, what is working at this point in time?
Well, so we're currently covering 9 million in Africa. Yeah, billion would be amazing. But, and so, I think I agree that it takes time to actually see outcomes. But, I would say generally across the world where we see digital infrastructure in place, it does increase economic opportunity. And so, and it increases, access to education and all of the various things that the digital infrastructure can support. But agree, it takes some time.
Yeah, look, I can give you a couple of live examples, right? At the moment, if a system goes down, so GE Healthcare, we manufacture large-scale radiology equipment predominantly and offer digital solutions around that. So your X-rays, your MRIs, your CTs and things like that, right? So what we can do right now, when we install systems at a facility, we can offer clinical applications training to the actual operator digitally now through tablets. You can't do that if you don't have internet, right? If you look at from a fixing of systems, we fix probably about 40 to 45% of our equipment remotely now. Again, if they're not connected to the internet, you can't do that. And we have a goal of getting to like 80% of equipment being fixed remotely just by dialing in from somewhere to fix the system versus having an engineer in a car driving to a facility somewhere in the middle of Nairobi and then getting out and trying to fix it. So again, the whole kind of healthcare infrastructure development can only really happen if it's digitized, right? And then going back to my earlier point, that if you've got information, insights on patients that's available, clearly, you know, with all of the appropriate security around that from your facilities, then you can now connect systems that are working to clinical insights to be able to provide better healthcare for patients on the continent. So it's absolutely fundamental on how we move forward.
Eyong, I saw that you said somewhere, I'm going to take your quote.
Oh, no.
You said, in the coming years, I expect to see the biggest ever improvement in healthcare infrastructure to date. What gets in the way of that? I mean, this is all, we're talking positive here, but what gets in the way of that progress?
Yeah, so again, I always think, for me, from a GE healthcare perspective, we talk about big healthcare infrastructure, right? So hospitals, primary healthcare centers, oncology centers, that's what we do, right? And that's what's needed on the continent. And the continent has the biggest gap in that type of stuff. Why I'm optimistic about it, what things get in the way, historically, there's always been capital available for these projects. The challenge is having bankable projects to be able to access that financing and those funds. You've also historically, not had governments very much focused on this, and I think the pandemic clearly has shone a big light on the need for investment in local infrastructure, because no matter how big you are, you can't typically jump on a plane, or you couldn't jump on a plane during COVID. So I think it focused minds on the need to invest in their infrastructure. And then I think the other piece around that is the kind of ecosystem work that we're doing with the likes of Microsoft or AWS, et cetera. We're starting to talk about ecosystems versus I build a CT and I want to put it in a hospital. No, I'm talking about we build a system, we build a CT, we digitally enable it, we work with Microsoft, who has data in the cloud that's able to provide insights and develop the entire clinical pathway. And then we work with small African-based tech startups that are able to provide applications to local facilities that they can actually be able to access data for their patients and for their for their physicians. So I think what got in the way was we probably looked at things in a very siloed way. I think what we're doing now is looking at it as a true ecosystem and sharing information, which we can do now in a much easier way based on the fact that it's digitized.
Do you agree with that, Teresa?
Well, I was thinking about the things that I think are barriers, or maybe what I would say where I think governments can help. And I would say, one, to treat digitalization and access to the internet as infrastructure, really invest. I think that's a really important thing. I think for governments to work with private sector and industry to identify what skills are needed. As we're sort of thinking about the skills of the future, we can kind of see. So we put more people online, we need more cyber skilling. And so we're offering some cyber skilling offerings as well, but we can really work together, I think. Government and private industry can really work together to identify what are the workforce needs, and then as we invest in those workforce needs and that skilling, it opens up entrepreneurial opportunity because people have those skills that then can create more opportunity, and it continues to build. And then I think just sort of creating the right enabling regulation ecosystem. And I don't mean that to say we resist regulation, because Microsoft actually doesn't. We sort of welcome it where it's common sense, but to recognize that operating across borders can be challenging unless the regulatory infrastructure kind of enables that. And then even just really specific practical things like permitting processes. So if we're building a data center, we can get really stuck in a permitting process that makes it really hard to continue the investment. So just generally speaking, I think those are the places where they can be barriers or they can be real enablers and unlock the opportunity.
What would be common sense regulation, as you mentioned, that would unlock this opportunity in your opinion?
Yeah, I mean, I think one of the places we talk a lot about is cross-border data flows. Yeah. You know, if the rules are really strict around what you can send across a border, it makes it harder to take advantage of digitalization and innovation. So I think that's sort of the most immediate answer.
And I think, you know, I saw another report from the IFC and Google, which was talking about Africa's internet economy being one of the most overlooked investment opportunities. I mean, we're talking about this being the right thing to do, right? But as a business, I mean, are you seeing, what are you seeing?
Yeah, I mean, it's an extraordinary opportunity for growth, for business growth. If you have 60% of the population 25 and younger, I mean, that's an enormous opportunity for us for new business. And you know, I think 6 of the 10 fastest growing economies in the world are on the continent. So, I mean, it just doesn't make sense to not go, not be there. I mean, we've been there for about 30 years, but you know, continue the investment because it's so important.
Have you yet, though, seen the returns?
Oh yeah, absolutely.
Yeah,
absolutely. Yeah. I mean, we have 12 offices. We have something like 21,000 partners. I think one of my favorite statistics, you see I'm like catching them in my head, is that for every $1 that Microsoft makes on the continent, our partners make 9. And so that's really aligned with the Microsoft mission, which is really kind of creating that infrastructure so other companies, other organizations can really build on top of it and find, you know, innovative solutions to local problems.
And when we talk about, just before we wrap, regulation, because we were talking about sort of how it works depending on which country you're in, we're in the US where there's a lot of debate over regulation, over a vast amount of things, from AI, from, you know, crypto today, everything. What I wonder can be learned, Eyong, maybe you can start, from the way potentially the US is going about governing policies. I mean, the Biden administration came out with its own AI Bill of Rights. I mean, should there be anything taken from what's happening here, or should it be completely?
It's a bit of a tricky question. If I say no, it's great to be unregulated. We can get a lot of stuff done. Yeah. You know, skeptics in the room go, "Oh my God, they're going to take my data and do kind of crazy stuff with it." So I think that there's a lot to learn from how some of this regulation's been rolled out in mature markets to make sure that we don't fall into those same traps, right? I think also if you look at the continent, you have a much more trusting population and a much more trusted environment. So if I look at, you know, licensing of medical devices and equipment, the vast majority of sub-Saharan Africa is unregulated, right? So it's how you support and work with governments to develop. And the beauty of what we do is we're able to actually work and support governments to develop policies that absolutely protect the people, the governments, the countries, but are not blockages for the need to be able to leapfrog and catch up and surpass the mature markets and developed markets. We have a unique opportunity to do that. You know, I originally, you know, worked in the UK, and I found it quite frustrating that some of the policies and the regulations stopped us from doing some amazing work. What's so wonderful and beautiful about working across Africa is we can sit down with industry bodies and work with governments to develop policies that enable us to be able to do the work that's super interesting and super needed by the countries. So we're kind of developing with partners, and that's why, again, it's important that you have multiple stakeholders at the table, right? Just so you can kind of offset any kind of force majeure going on. But if you can sit down with our industry partners, and we sit down with our competitors as well, with governments to develop policy that allows us to get things done and get things done quickly, I think it's there's a big opportunity there to move forward.
Yeah, and I would just build on that. I think one of the places where regulation goes awry is where it's the people who are writing it don't understand the underlying technology. So being at the table with technologists or businesses who understand, well, we actually can't do it. We can't architect that way. If you architect that way, you are kind of undermining the value of the technology. And so I think, you know, really close partnership between government and people who understand technology for, you know, for the work we're doing is really, really important. And the places where it's gotten the most tricky are the places where it's sort of been like, well, you can just turn it off. Well, no, that doesn't actually, it doesn't work that way. And so I heard this really interesting idea from a university in Spain where they said, we want to create a program where we're educating tech diplomacists. And so that as a profession, I thought that was just brilliant, right? Somebody who can sort of translate between the businesses and the legislators to kind of really come to something that meets the problem in a way that can actually be acted on and doesn't undermine kind of the entire technology.
Wow. Do you have tech diplomacists within Microsoft?
No, I mean, it's actually, it was the idea is it's a government position. So Denmark has done this. But, you know, it would be somebody who works in the government and then works with technology companies and government. I just thought it was a fascinating idea. Yeah.
And then just finally, Eyong, let's just end on healthcare because we know how critical it is to the continent and to any sort of growth that we're seeing from such a young group. What is it that you're sort of hoping for? What is GE sort of hoping for in the near term to ensure that we're on the right path?
I think keep the focus. Again, you know, I don't like talking about the pandemics, but the upside of it is you now absolutely have governments totally focused on healthcare. You've got capital being lined up for Africa to invest in healthcare infrastructure. You've got, you know, development financing organizations absolutely got to focus on Africa. You've got this health tech explosion happening across, be it, you know, in Nairobi, in Yaba, in Lagos, in South Africa. You've got this, you know, tech startup explosion that organizations like GE and those of Microsoft with their partners program absolutely need to key in and have part of the solution, right? So we're doing a lot of work in connecting with tech startups that have an interest in the areas that we focus on in healthcare, bringing them into the ecosystem and enabling that local knowledge and understanding to be able to help us deliver better healthcare in the countries that we serve on the continent.
Well, and hopefully we can see that translating into.
Yeah, you're a bit impatient, but it
really
will happen.
I think we all are.
It's good. hold us accountable.
I know we have to. Teresa Hutson, Eyong Ebai, thank you guys so much. Thank you everyone for listening to us.
Thank you.